Good evening, viewers. I'm very, very delighted today to share with you Dr. Bindu Menon, all the way from Nellore, Andhra Pradesh. She's a very highly acclaimed neurologist. And I will, without much ado, I will ask ma'am to uh, tell us all about her very, very acclaimed degrees, which I would, due to my loss of memory, I don't remember, but they're so high flying. And ma'am has traveled all over the world, and she's so highly qualified. And as you can say, she's so gorgeous looking. Ma'am, please tell us all about your degrees and what is your long term goal with these degrees? Where do you plan to go? What do you plan to do?
Thank you very much, Preeti, for having me on this talk show. Preeti, I think I have met you just a month ago, and that was in one of the advocacy meetings. And Preeti came forward as an extremely positive-minded person, and I should say Preeti was just impinged onto my heart and brain, because so much of positivity you emanated on the stage on that day. Everybody was looking up to what you are going to talk and how you spoke and how you portrayed yourself. And Preeti caught me to that. Actually, I was thinking that I would want to interview Preeti. Can you imagine Preeti won the race there as well, and Preeti interviewing me now? Though I think it should be on the opposite side. I should be interviewing you, Preeti, because you, as a person with epilepsy, have grown up, come up to this level. I'm a neurologist, as any other neurologist. I'm just doing my work, I should say. And as far as the degrees you're asking, which I have, they're just when we complete our MBBS, then we do our MD, then we do a DNB, then we do a specialization, then we do a super specialization, and then we get some fellowships from some acclaimed organizations and bodies like the American Academy of Neurology, Indian Academy of Neurology, the Geriatric Society of India, the Association of Physicians, for your work which you do. This could be as part of academic work, social work, philanthropic work, publications, and all those things. Each degree that we get is a pedestal for us, that we have reached that level, and it's I would say that it's a dopamine for us, that there's a happiness within you, that you are one person who would know that where you stand today.
Yes.
Yes, how much happiness you have within you because of the effort you put in, and that was shown. So all these degrees are not to reach any other. We have already reached that, and we get to get the happiness and the pleasure and this accomplishment from that, and which tends and motivates us to do more in whatever way, not for getting degrees, but to get back and give back to the society what we have achieved.
Yes, ma'am. Ma'am, I visited your site, Dr. Bindu Menon Foundation, and what fascinated me most was the neurology on wheels campaign. You're going from small villages to villages and treating patients in your native language. So this kind of campaign that you're doing, is this kind of epilepsy awareness, is it possible in up north for this kind of removing the stigma and one-to-one conversation with the poor people, with the villagers? Is it, do you think we can do it up north here?
Yes, Preeti. A question well put, Preeti. Actually, my foundation, we launched it in 2013, and how it with my blessings of my parents, who are the backbone and pillar and strength for me for all my accomplishments and what I am today. As you said, those degrees, I think it's because of them. So from there, when we started to see where we can help out the people who are below the poverty line, and we could reach out to them, we felt that the people are coming to our foundation and getting the treatment, but then there's an outreach area where there's a rural area who really don't know where to go, what to do, and are stigmatized, as you rightly put in. So we need to reach out to them, and we need to reach out rather than they reaching out, because they will never reach out to us because of several reasons, which everyone is aware. So we started this Neurology on Wheels campaign from the foundation in 2015 with the motto of we reach, we teach, we treat. So we reached the remote area, which is in a radius of 100 kilometers, the remotest where the health services are not adequate. We teach because the whole village comes in, Preeti, you know, when we go off with our bus there. So everybody is wanting to know what has happened, who is there. So we take advantage of that and we give them a counseling session. I talk to them about epilepsy, the myths, the stigma first. And then we start our screening. We do EG in a couple of patients, and then we start.
And
This
it's all
can
free.
be this.
It's all free,
Yes,
ma'am.
yes.
Okay.
Yes, this free. So some of the villages, Preeti, we have visited. We revisit those villages because one time sensitization probably is not enough, and because there's a lot of treatment gap, patients tend to stop the medication. So we visit those villages after 3 months. So probably I can say, because of the fear that the doctor will come again and ask whether you're taking medications, they might take it, or the belief that yes, the medications are supposed to cure the disease, so or control the fits, so I should take it, so the doctor will again come. So we revisit them. This is a model of care. This is a model of care that we have come out. This sort of models of care can obviously be extrapolated into other areas, and this is a sustainable model. And yes, as you said, this can be tried off in the country very well.
But ma'am, suppose there's a patient, like you also deal in strokes. Suppose there's a patient you see in the village who's little more severe than most patients who's got the epileptic seizure, which is much more severe. Do you take the patient back to the city? Suppose you don't have in the bus enough equipment to treat the patient there. तो आप क्या करते? Do you take the patient back into the city? I mean, how do you manage that?
वेरी गुड क्वेश्चन प्रीति, क्योंकि हम जब कैंप में जाते हैं तो वहाँ पे द सिवियरिटी ऑफ एनी डिजीज रेंज करता है. कुछ तो गुड एंड वेल कंट्रोल्ड एपिलेप्सी पेशेंट्स रहते हैं, बट पेशेंट्स टैबलेट्स पे नहीं रहते हैं. कुछ दे आर वेरी सिवियर एपिलेप्सी ऑल्सो, जिसको दे नीड इन्वेस्टिगेशंस एंड दे नीड ए केयर विच इज ओवर एंड अबव एक अपन गांव के बस में दिए जाना केयर नहीं हो सकता. So what we tell them, if they need first line or second line medications चाहिए रहता है, तो as I told you, हम लोग per month हमारे कैंप करते हैं हमारे हॉस्पिटल में भी, तो उसमें आने को बोलते हैं, which is every month on one Sunday of every month, where all the patients stroke and epilepsy दोनों भी आते हैं. Or else, if they are, that is also not sufficient. That means some of the persons with epilepsy might need surgery as well. तो हम लोग उनको रूट करते हैं कि एपिलेप्सी सर्जरी कहाँ हो सकता है. तो इसके लिए थोड़ा सा डिस्कशन चल रही रहता है, क्योंकि इट्स नॉट इजी ऑन अ कैंप. हम बोलें कि आपका तो बहुत ज्यादा, तो हम पहले उनको कैंप, हमारे हॉस्पिटल के मंथली कैंप, ताकि वो थोड़ा सा एडजस्ट हो जाए, उनको समझ में आ जाए कैसा करना, कैसा है, ये मेडिसिन से पूरी तरह से कम नहीं होगा और ऑल्टरनेटिव है. तो देयर इज अनदर वे टू गो अबाउट इट. तो उनको फिर हम रूट करते हैं. सो लिटिल मोर लॉन्गर प्रोसेस, बट देन अ डूएबल प्रोसेस.
Okay. And ma'am, like I have a friend, I mean, not a friend, is an epilepsy warrior again. He's from Chhattisgarh. Now he told me about this a problem that in his village there are so many of these epilepsy patients, but by the time they need to go for an MRI, there's a head injury. The village is 20 kilometers. Something else can happen to the patient. Now this way, there's nobody like you there. So this way, the government should try to come and help, but not even a neurologist, there's no dispensary, there's nobody noble like you who's taking buses and going there. So don't you think the government or the local MLAs should pull in and try to help? I mean, some kind of
Excellent. Actually, regarding this particular issue, this time, surprisingly, you asked that, Preeti. Very well put question, actually. WHO in this assembly, the 73rd World Health Assembly में जो table हुआ है, उसमें integrated global action plan for the next
Okay.
10 years अब पूरी तरह से neurological disorders पे ही focus होने जा रहा है, and the entry
Okay.
point of it is epilepsy. So I'm sure,
Okay.
Preeti, because every state in the country has got different health demands. कुछ states में अभी भी communicable diseases बहुत ज़्यादा हैं. कुछ states में non-communicable diseases like stroke and epilepsy बहुत ज़्यादा है. And we have the global burden of disease format and the full data also with us. So I think probably in the coming months and in the coming years, all the stakeholders are going to get involved, will have to get involved and will get involved because there is a global action plan against
Yes,
this. So
that's much
it
needed.
Yes,
Yes.
it will be done. Yes.
Ma'am, I also read on your website that I think you're the first person in India to launch an epilepsy app for most of us patients, you know. So can you tell us about that? I think it's on, you launched in 2016. So how does it work, and how do, like, I'm a patient, how do I reach out to, how does the app work, and how do we reach out to a doctor? I mean, how does it work? Could you please explain that?
Preeti, actually, this app was launched for the simple reason that जब मैं OPD में बैठती थी और कभी-कभी emergency में रहते थे, तो patient when they used to come into the emergency and they just had a seizure while they were at the workplace or they were having a party or whatever place, they just used to be shifted to the emergency, and then we never used to have any details of the patient. And then it is justified. We can't carry all our investigations with us all the time.
Right.
So in mind, I felt this is a disease where a person can have a seizure at any point, any place, any time. So the
Anywhere.
information should be there. But patient might not be in a position to give out the history because he can be in a post-ictal status. फिट के बाद थोड़ा drowsy है, थका हुआ है, तो उस समय याद करके उससे पूछना सही नहीं रहेगा. सो उससे हमने एक ऐप तैयार किया, एपिलेप्सी हेल्प है, प्रीति, EPILEPSYHELP, एपिलेप्सी हेल्प. वो एंड्रॉइड फोन्स में है, एप्पल फोन में नहीं है. इट्स अ फ्री डाउनलोड फ्रॉम द प्ले स्टोर.
राइट.
स्टोर में से
हाँ मैम, आप इंटरव्यू के बाद व्यूअर्स, आई विल टेक द लिंक फ्रॉम मैम एंड आई पोस्ट इट इन द अंडर माय यूट्यूब चैनल. आप प्लीज डाउनलोड कीजिए, एंड वी मस्ट डाउनलोड द ऐप. एंड्रॉइड में है. प्लीज फॉर योर पेशेंट्स, केयर गिवर्स, फॉर योर फैमिली मेंबर्स, डाउनलोड कीजिए. इट इज, प्लीज हियर मैम, इट इज फॉर योर इमरजेंसी एंड फॉर योर रिकॉर्ड. यस मैम, प्लीज कंटिन्यू.
I'll send, yes, as you said, I will send that link where they can download. It's on the, तो उसमें हमारे पास we have got this 15 labels on it. उसमें फाउंडेशन के बारे में, और फिर 3 लैंग्वेज में है प्रीति, इंग्लिश, हिंदी एंड तेलुगु, where I am from. And then about epilepsy, उसके बारे में पूरा 3 लैंग्वेजेस में है. फिर then their details, their demographic, age, gender, age, phone number, then the history of the patient, वो अपना पूरा था उसके अंदर, कब आया, क्योंकि it is very difficult, क्योंकि कुछ लोगों का बहुत long history रहता है. Sometimes it's very difficult to always remember everything. उनका medication list डाल सकता है, medication का alarm डाल सकता है, पाए उसका अपलोड, पूरा उसका डाटा रख सकता. अपलोड मीडिया एक है, उसमें अपन फोटो, अपना MRI का फोटो, EEG का फोटो का रिपोर्ट, ब्लड रिपोर्ट, इन्वेस्टिगेशंस और एनी अदर. और कभी किसी को फिट आया, किसी ने बाईस्टैंडर ने वीडियो लिया, सोचो, तो he can just transfer his to his mobile, and later when he comes to the hospital he can even put that, that can be also saved in that upload media. अपॉइंटमेंट रिमाइंडर्स है. फिर उसके बाद हमने प्रिवेंटेबल फॉर्म्स, फिर फर्स्ट एड का एक वीडियो है, क्योंकि व्हाट यू सी यू बिलीव एंड यू अंडरस्टैंड बेटर देन व्हाट यू रीड. फिर उसके बाद एक यू आर नॉट एलोन, जैसे प्रीति has been advocating all across that you are not alone, you should move out. My daughter has sung a song in that, and she has written that lyrics also. And there's a contact.
Okay, okay.
It's a help for the patient. I understand that whatever way, small way, we can make a small change, which will
Yes.
help. I think I was reading a book in that the way you have kept your alarm taken, yeah, that
Yes, ma'am.
medicine,
You
and it was
have
wonderful.
you got my book
Oh,
with you, ma'am?
I absolutely, absolutely. Because the schedule, it was as I'm traveling. So usually when I'm traveling, I'll carry a book. So yeah, oh God, we seem to be we seem to be like twins now with this book.
And ma'am,
Pretty
what did you like
such a
most about
wonderful.
my book? What did you like? Something, any one thing you liked about the book?
There's no one thing there. There's so many things. But as I was just telling you and the people who are watching this interview, she has so beautifully kept her alarm as taken, because there are several times when we keep
It's
an
a
alarm.
movie's
Yes,
name.
yes, it's a movie, a Hollywood movie's name.
Yes.
In the same this that you may keep an alarm, but then you may download the app, but then you have to devise your own method as to
Yes.
how to use that app in a most effective manner, as you have kept that taken. I think in this the true life stories of all warriors, combat mode, wielding confidence, and the warrior queen, of which I would like all the viewers to go ahead and read her book. And the author's note is just awesome.
Thank you, ma'am.
Preeti, when I sit in the outpatient, I try my small bit to see that my patients are empowered. I will see that they read, they pass off their exams in whatever way and get some degree, even if they don't work, but then I may ensure that they stand on their feet. Some of them agree, some of them not. But when I was reading your author's note, Preeti, I was just moved. It was just
Thank you,
awesome.
ma'am. Thank you, ma'am.
How beautifully I've written scars with sunny smiles. It's such a nice metaphor. And the way you have written, I have been brutally honest, blunt, and bold about myself in this book. And that sort of confidence with the humbleness and the humility that you have had, because in the next line you write, please feel free to judge me. You have been open that, yes, I am like this, but then you also have the right to judge me. Absolutely wonderful. I would recommend that every person with epilepsy reads it. The love for the family that she has shown here, as all of us always have. And everywhere she has written that the person with as a person with epilepsy, she has not blamed anybody, and she has just moved from one step to not only a person with epilepsy, any person who has a
With
stigmatized disease, yes, I think needs to move forward. And waging wars, this is another sort of war in which there is an emotional war. There are some physical wars, and that's awesome. I think, thank you for that day, for giving me this book.
I
Everything is
have
awesome.
to thank you so
The author's
thank you.
note is just awesome. The author's note is just awesome. Yeah.
Thank you so much,
Yes.
ma'am, for such kind words. I'm getting goosebumps hearing it. I
No,
thank.
I got a goosebump when I read the author's note. That's what I'm saying. I have so many more to read in that. I just read the author's note and yours and the Warrior Queen and one of the majors. Yes, they're all extremely good, very well written as well, and very well portrayed.
I have to sincerely thank Dr. Kharbanda for making me meet you, ma'am. And viewers, the book is available on Amazon and signed copies are available with me. And ma'am, I wanted to ask you a very common question, which most people ask. People ask me, I'm not a doctor, but I can talk out of experience that common question is that a lot of people ask with epilepsy medications, we put on a lot of weight. So is that true? Can that be avoided?
Yes, Preeti, that's right. Actually, with some of the anti-seizure medicines have weight gain as a side effect. So while we are initiating the patient on the medication, most of the times as neurologists, we tend to see the profile of the person the age, the gender, whether the person of childbearing, all of these things we do keep in mind, whether the person can how long the medications may be required. So while initiating itself, we are a little we need to scrutinize and try to avoid those medications. Having said that, sometimes when we have only those medications which are ensuring a very good seizure control, but side effect may be a weight gain in those particular patients, then there are certain other tests we need to see whether if it is a woman, whether she has got any PCOD, any hormonal disturbance. Keeping all those things aside, the anti-seizure medication and the hormonal or anything, I would recommend that any person who eats healthy and is physically active, everybody should ensure that they're physically active, irrespective of whether they have a disease or not a disease. So most of the times we feel that nowadays it's a little bit of a sedentary lifestyle that is going on in each and everyone. The children especially, they have got a packed school curriculum. They get up in the morning, then they go for tuitions, come back, then go off for tuitions. So by the time it's a 9 to 9 job for them, I should say. So in an outpatient, I'm not able to tell them that kindly go for some games, go for walking, go for cycling. So I think as parents, they can a little bit take a leverage and ask the school authorities to send them off a little earlier so that they can get engaged in the physical activity which is recommended by the neurologist. So a little bit here and there, and if from the initiation one takes a little control, then the weight gain can be kept in check to a large extent.
But I think, ma'am, one has to forget being a patient and be a beautiful, slim doctor like you to lose weight. What is your secret? Why are you so gorgeous? You're so gorgeous. You don't look like a doctor. Please tell us. The nation wants to know. How do you maintain yourself? How do you do yoga? How do you maintain yourself? This is the last question. We just have 5 minutes left. You have to tell us.
Oh my God.
I think we have to become, all the doctors are so slim and good looking. All the patients are so, this thing. So please tell us, the nation wants to know. How do you maintain yourself?
She does not want to know. I think Preeti wants to know, and she is taking the advantage of the interview. No, I, nothing is there. I do not get time for yoga, but yoga is extremely good, and I would recommend for patients, especially if they do yoga, they can synchronize the body, their physical activities, and the mind. They can concentrate. Their attention span can increase. Some form of outdoor exercise is very important, and simple walking with your shoes on, nature walks are excellent, because you tend to see, you tend to hear, you hear the birds, you see the trees, and you consolidate your whole day's activity and you plan while you're walking. It's a sort of refreshing refreshment. And I suppose I am like this because my mother feeds me, and I just hung up on my mother's.
I think it's because the love and the care you give to society, it comes back and glows on your face. I think it's just that what you give comes back. Like even good karma always returns.
Yes, and you are aware of that. Yes.
With that, ma'am, thank you so much for giving us your valuable time. And I will look forward to coming and meeting you soon. Hopefully, we'll meet again. Maybe in the cosmos will connect us again in some conference again, neurological conference again. Okay, and then you're going to ask me, Preeti, why do you talk so much? And I'll say that I'm often called Basanti from Sholay.
No, Preeti, you talk so much, but that you talk so wonderfully well, and all our blessings for you, so that you can continue on this waging the war and decreasing the stigma and motivating all the people with epilepsy. You're just doing wonderful work. God bless you.
Thank you so much, ma'am. Thank you so much for your time. God bless you too. Thank you, ma'am. Bye-bye.